Mental health disorders affect both men and women of every ethnicity. In some cases, people may be living with several types of mental disorders despite these disorders affecting their thoughts, feelings, and behavior. Hello viewers, welcome to our YouTube channel. Today in this video we will show you 10 common mental health issues and how to tackle them. However, before we start our countdown, we would appreciate it if you would subscribe to our YouTube channel and also press the bell icon. So, let's get started. Number 1. Depression. Depression refers to a wide range of mental health problems characterized by the absence of a positive affect, low mood, and a range of associated emotional, cognitive, physical, and behavioral symptoms. Distinguishing the mood changes between clinically significant degrees of depression and those occurring normally remains problematic, and it is best to consider the symptoms of depression as occurring on a continuum of severity. Commonly, mood and affect in a major depressive illness are unreactive to circumstance, remaining low throughout the course of each day, although for some people mood varies diurnally, with gradual improvement throughout the day only to return to a low mood on waking. In other cases, a person's mood may be reactive to positive experiences and events, although these elevations in mood are not sustained, with depressive feelings often quickly re-emerging. Behavioral and physical symptoms typically include tearfulness, irritability, social withdrawal, an exacerbation of pre-existing pains, and pains secondary to increased muscle tension. A lack of libido, fatigue, and diminished activity are also common, although agitation and marked anxiety can frequently occur. A loss of interest and enjoyment in everyday life, and feelings of guilt, worthlessness, and deserved punishment are common, as are lowered self-esteem, loss of confidence, feelings of helplessness, suicidal ideation, and attempts at self-harm or suicide. Number 2. Generalized anxiety disorder. The essential feature of GAD is excessive anxiety and worry, occurring on more days than not for a period of at least 6 months, about a number of events or activities. The person with GAD finds it difficult to control the anxiety and worry, which is often accompanied by restlessness, being easily fatigued, having difficulty concentrating, irritability, muscle tension, and disturbed sleep. The focus of the anxiety and worry in GAD is not confined to features of another disorder, for example having panic attacks or being embarrassed in public. Some people with GAD may become excessively apprehensive about the outcome of routine activities, in particular those associated with the health of or separation from loved ones. Number 3. Panic disorder. People with panic disorder report intermittent apprehension and panic attacks in relation to particular situations or spontaneous panic attacks with no apparent cause. They often take action to avoid being in particular situations in order to prevent those feelings, which may develop into agoraphobia. The frequency and severity of panic attacks varies widely. Situational triggers for panic attacks can be external or internal. A panic attack may be unexpected, that is, one that an individual does not immediately associate with a situational trigger. The essential feature of agoraphobia is anxiety about being in places or situations from which escape might be difficult, embarrassing, or in which help may not be available in the event of having a panic attack. Number 4. Obsessive-compulsive disorder. OCD is characterized by the presence of either obsessions or compulsions, but commonly both. An obsession is defined as an unwanted intrusive thought, image, or urge that repeatedly enters the person's mind. Obsessions are distressing, but are acknowledged as originating in the person's mind and not imposed by an external agency. They are usually regarded by the individual as unreasonable or excessive. Common obsessions in OCD include contamination from dirt, germs, viruses, body fluids, and so on. Fear of harm, excessive concern with order or symmetry, obsessions with the body or physical symptoms, religious, sacrilegious, or blasphemous thoughts, sexual thoughts, an urge to hoard useless or worn-out possessions, or thoughts of violence or aggression. Compulsions are repetitive behaviors or mental acts that the person feels driven to perform. A compulsion can either be overt and observable by others, or a covert mental act that cannot be observed. Number 5. Post-traumatic stress disorder. PTSD often develops in response to one or more traumatic events, such as deliberate acts of interpersonal violence, severe accidents, disasters, or military action. Those at risk of PTSD include survivors of war and torture, of accidents and disasters, and of violent crime, refugees, women who have experienced traumatic childbirth, people diagnosed with a life-threatening illness, and members of the armed forces, police, and other emergency personnel. The most characteristic symptoms of PTSD are re-experiencing symptoms. People with PTSD involuntarily re-experience aspects of the traumatic event in a vivid and distressing way. Symptoms include flashbacks in which the person acts or feels as if the event is recurring, nightmares, and repetitive and distressing intrusive images or other sensory impressions from the event. Number 6. Social anxiety disorder. Social anxiety disorder, also referred to as social phobia, is characterized by an intense fear in social situations that results in considerable distress and in turn impacts on a person's ability to function effectively in aspects of their daily life. Central to the disorder is a fear of being judged by others and of being embarrassed or humiliated. This leads to the avoidance of a number of social situations and often impacts significantly on educational and vocational performance. The fears can be triggered by the actual or imagined scrutiny from others. The disorder often begins in early adolescence, and although an individual may recognize the problem as outside of normal experience, many do not seek help. Panic attacks are common, as is the development of depressive symptoms as the problem becomes chronic. It is also often comorbid with other disorders, such as depression. Number 7. Specific phobias. A specific phobia is an unwarranted, extreme, and persistent fear of a specific object or situation that is out of proportion to the actual danger or threat. The fear and anxiety occur immediately upon encountering the feared object or situation and tend to lead to avoidance or extreme discomfort. The person with a specific phobia recognizes that the fear is excessive, unwarranted, or out of proportion to the actual risk. Specific phobias result in significant interference with the activities of daily life. They are usually grouped under a number of subtypes including animal, natural environment, blood injection injury, and situational. Number 8. Eating disorders. Anorexia, bulimia, and binge eating disorder are the most common eating disorders. Many people with eating disorders feel out of control in other areas of their life. The one thing they can control is the food that enters or exits their body. With anorexia, calorie restriction is the main objective. With bulimia, a person will binge eat and ingest enormous amounts of calories. Once they are done binging, they will feel guilty and the overwhelming need to purge the food they consumed. Binge eating disorder involves consuming large amounts of food but without the purging. The guilt is severe, however. Number 9. Borderline personality disorder. A borderline personality disorder is said to make a person unable to maintain positive social relationships. You become emotionally unstable, impulsive, and your self-image is damaged. Your moods may range from having a fear of abandonment to explosive anger outbursts. Moods like this are typically uncontrollable. Severe borderline can leave you feeling paranoid. Number 10. Bipolar disorder. Bipolar disorder refers to the two moods involved with the illness, both on the opposite ends of the spectrum from the other. On one side, depression. Your bipolar depression can vary from being unable to get out of bed to feeling like you have the blues. In bipolar disorder, your depressive symptoms cycle to the other end of the spectrum, mania. Mania is sometimes seen as positive because you have a lot of energy. You accomplish a lot. However, you may also participate in risky behaviors that can be fatal. Then, when you cycle back into a depressive mood, the crash can be devastating to you, your family, and even your employment. So this was our today's video. I hope you all liked this video. Don't forget to hit the like button and subscribe our channel. And also share it with your friends and family. We will be back soon with a new video. Till then, keep supporting and take care.